Hello, welcome to Unit 4 of the RIA Manual for MAP. We are going over Unit 4 today, which is talking about interacting with a healthcare provider. Responsibilities you're going to learn is procedure to make sure that the healthcare provider visit is successful, when medication reconciliation is required, the process of taking a telehealth or telephone order, and requirements to use an existing supply of medication when there is a dose or a frequency change. Sometimes the changes you observe and report result in a healthcare provider visit. You may go with the person for a particular problem, issue, concern that you or other staff or the person supported wants to discuss with their healthcare provider. You're also going to go to their annual physical exam. There is a procedure to make sure that you're prepared for the healthcare provider visit. The procedure is as follows. Prepare the person for the appointment. Tell the person the date and time when appropriate. Keep in mind that some people may have severe anxiety if they know too far in advance. So in some circumstances, it may be best to let them know the day of or an hour before in order to best assist them to get through a difficult time. You're going to discuss what will happen at the appointment. Sometimes that's reassurance, letting them know specifically what's going to happen can really reduce anxiety revolving around a healthcare provider visit. And any instructions that are ordered to prepare for the visit. For example, some people take pre-medications that will help with anxiety prior to an appointment. And sometimes they need to be fasting, such as no food or fluid prior to the appointment. You want to think about items that will help the person feel relaxed. This can include music or stress balls, other comfort items. I've known people to have weighted lap pads, magazines, fidget toys, listening to music, their iPad, something that can be really comforting for them to bring to that appointment. You want to always make sure that those items are taken. And also encouraging the person to wear loose and comfortable clothing in the event that the healthcare provider needs to physically examine the person. Before leaving the site, you want to make sure that you have the person's insurance card, a copy of their current medication sheets or a list of their medications. You want to have a healthcare provider encounter form, which a basic picture is on this page of what that looks like. You want to make sure that the staff portion at the top is filled out. That includes the person's name, date of the appointment, their allergies, reason for their visit. It doesn't say on here, which it should, is the person's date of birth, because any order needs to have the date of birth of the person supported on the sheet. So under the person's name, should be date of birth, the reason for the visit, current list of medication, which includes any dietary supplements and PRNs, the name of the healthcare provider, and the signature of the staff person completing the form. On our forms, the signature of the staff taking the person to the appointment would be located at the very bottom of the page. And you're going to see, for example, David Cook here is seeing Dr. Black. The reason for the visit is David states that he is burning in his throat after eating. A current list of medications, which he only takes a couple of meds here. But in the event that the person takes several medications, it's usually best to accompany a copy of those attached to this form. And you're going to see that the person put their name, and then the doctor would fill out the rest of the form there. Each department, DDS, Department of Mental Health, and DCF, which is the Department of Children and Families and Mass Abilities, use standardized forms and or tools and use the forms that with the required information that must be included relating to a healthcare provider visit. So you ask your supervisor what healthcare provider visit forms are required to support the people that you support. And other staff may complete the paperwork. Sometimes this happens where, the manager or a lead DSP fills out the paperwork in advance, and then you as the staff person may accompany them to the appointment. A couple things you also need to keep in mind are driving directions. So make sure you know which building or which address you're going to. A lot of healthcare facilities have multiple sites, like, for example, Cape Cod Healthcare, Atrius, Beth Israel Deaconess. They have multiple sites all over Massachusetts. So you want to make sure that you know which site you're going to. You may need money for parking, gas, food, or drink. Keep this in mind. I used to take a woman supported to Boston, and we would do the valet parking because she had a hard time walking long distances, but didn't quite need a wheelchair. So we would do the valet parking, and it was $10 with her handicap plate. So I would just drive up. We'd get everything out of the car that we, needed for the appointment, and then leave the car with valet. And then they would get the car for us when we were ready to go. And so that was always $10 cash. They didn't take credit. So make sure that you have that. Pack or prepare money for food or drink. You want to make sure that you have the on-call information in case you need to call somebody, such as the house manager, the nurse. If it's after hours, make sure you have the on-call numbers. Family and guardian information. This would be located on their emergency fact sheet. Name of the pharmacy that they use. So that's pretty much standard across the board for anybody who lives in a group home. We use East Bay's Pharmacy. Anyone in shared living. There's a couple of different pharmacies out there that the people we support use. So, you want to make sure that you know which pharmacy the medication should go to. And a charged cell phone. So whether it be a house cell phone or your cell phone, you want to make sure that you're prepared and have access to reach out should anything happen. When you first get to the appointment, check in with the receptionist, introduce yourself and the person that you're accompanying, state the reason that you're there. So, David Cook has a 2 p.m. appointment to see Dr. Black. Discuss any accommodations that the person may need. So this might be, if they need a sign language interpreter or maybe a darkened room to prevent overstimulation, if they need limited waited time in the wait room. So make sure you express any of those needs or accommodations for the person. During the appointment, you're going to assist the person if needed, advocate, encourage participation, and support abilities. So anything that we can have the person supported do on their own is great. Just remember, where there is a support person, not to take over the appointment. So allow the person supported to answer questions and be a participant in their own care. Provide the healthcare provider consult sheet to the healthcare provider to fill out, and any other forms that might be needed. Sometimes day programs require forms to be filled out, or Special Olympics, things like that the doctor may need to sign off on. Communicate the reason for the visit. So this is really important, making sure you know why you're there and making sure that you get to the bottom of that problem while you're there. So do they need a referral to another healthcare provider? Who is it going to be with? Where? What's the time frame on that? Kind of knowing what the next step is super important. If the person can speak about their health, I encourage them to do so. I already mentioned that. The healthcare provider may ask you questions, and redirect the healthcare provider to the person that you're assisting if that's appropriate. So I have been on appointments where, unfortunately, the healthcare provider looks to me for all the answers, when in fact the person supported could very easily answer those questions. Like, I do remember somebody asking me about somebody's stomach issues and how often they were complaining of stomach pain. And, they were just asking, and they just kept coming back to me. And I said, excuse me, doctor, you can absolutely ask them any questions, and I'm just here to support. So if there's anything they can't answer, I'll help it the best I can. So although I did know the answers to all the questions, it really was best that the doctor give the dignity to the person supported to let them be a participant in their own health. So don't feel bad about redirecting them, because it is rude for the doctor to just assume that you're going to answer everything. And ask the healthcare provider for answers to any questions that you or the person may have. Write down the information given to you that's not on the forms. Sometimes doctors will give you their impression or what their educated guess is, but they might not write everything down. So this is where, you can jot down some information, maybe some dietary guidelines to follow. This person has reflux or GERD. Maybe the doctor wants them to stay away from specifically chocolate or red sauce on pasta. So those type of things can get relayed back to the home, and that way we can get a good handle on it and make sure that the person doesn't receive those types of foods. Obtain any written results and recommendations of the appointment. So if you know that a person supported had lab work 2 days ago, and now they're having this follow-up with their doctor, get a copy of that lab work while you're there. That doesn't automatically come to the house. So it's important to get those documents, those test results while you're there, so that it can go in their record and we have a clear picture of what's going on. You're going to make sure that the healthcare provider's section of the form is completed. If there's any healthcare provider orders for medication, you're going to need to make sure that all 5 rates of the medication administration is completed. So the person's name, okay? The name is already on the consultation form. The medication name, the dose, the frequency, and the route. So believe it or not, sometimes the frequency or the route can be left off. I've had people that have had G-tubes and the doctor has written by mouth by accident, and we knew that it wasn't going to be a by mouth medication, because this person gets nothing by mouth. But catch it while you're there, because it will stall treatment when we don't have clear orders that we can administer the medications. You want to make sure that the person's allergies are on the consult sheet. Any healthcare provider findings, such as diagnosis or presumed diagnosis, any special instructions. For example, the one that comes to mind is Miralax, which is a very common medication ordered these days because it's very effective. And this particular medication, or polyethylene glycol is the generic name, has to be mixed with 8 ounces of any beverage to administer. And so if it doesn't say to mix with 8 ounces of liquid, then you'd be giving somebody powder that they would certainly choke on. So making sure that those special instructions are written on there. Any target signs and symptoms, instructions, or parameters for what to do with the medication is given and not effective for a PRN medication. So what this is basically saying is, for example, somebody has acetaminophen for headaches and fever. Let's say that if their temperature is over 100, or if they complain of a headache, you can give acetaminophen. So what do we do if we give the acetaminophen and it doesn't work? Well, it does take a little time for acetaminophen to work, right? I mean, it can take 30 minutes to an hour, sometimes quicker for some people. But if it didn't work by the 2-hour mark, perhaps we would have to reevaluate the situation or let the doctor know. So the order may say, call the healthcare provider if the headache is not resolved in 2 hours, or if the headache is not resolved or the fever is not resolved within 2 doses. So we don't want to just leave somebody suffering because their PRN didn't work. Something could seriously be wrong. Headaches can be symptoms of so many different things, but probably one of the most dangerous ones are brain bleeds or meningitis. And the people we support are not exempt from those things either. So we just want to make sure that people get the follow-up care as soon as possible. And acceptable healthcare provider signatures. So a wet signature is when the healthcare provider signs with ink and pen, or it could be an electronic signature, I skipped one, I apologize, the image of the healthcare provider signature. Sometimes this will automatically print on an office printout after a physical or after an office visit. Not for everybody, but I have seen them. And so we do need some kind of an acceptable healthcare provider signature in order to have a healthcare provider order. And then finally, the date of the order, including the year. So the full year needs to be present on any healthcare provider order. And that's why it's so important that when you're filling out the healthcare provider form, that you're putting the date and the time of the appointment and who it's with. Okay? When there is more than one page of healthcare provider orders, each page must be numbered. So for example, 1 of 4, 2 of 4, 3 of 4, and 4 of 4. So that way they're all fastened together as one packet. And when this is the case, the healthcare provider order only needs to be signed and dated on the last page. So that is helpful. So that way if you have 4 pages, or I have seen 6 pages, uncommon, but I have seen it. So in that case, you only need the last page signed. Healthcare providers' orders, including protocols and support plans, are valid for 1 year. Renewal orders usually corresponds with the person's yearly exam. So there are times when the exam cannot be scheduled before the orders expire. So this is where MAP gives us a little bit of leeway, saying, let's say you have a physical on January 1st, which happens to be a major holiday, so I doubt it would be January 1st, but let's just say it's January 1st, 2026. You have a physical and you have orders signed. Those orders are good for 1 year, but most insurance plans will not allow you to book another physical for 365 days plus a day. So that means the soonest you could get your next physical would be January 2nd of 2027. So in that case, the orders will not expire until their next physical. Now, and sometimes like you make your next appointment, but you're going to be on vacation that week. Not you, but the person supported is going to be on vacation, or the doctor's going to be on vacation. So you might have to bump it out a couple weeks. So their physical is going to be a year and 2 weeks difference. So those 2 weeks, you don't have to worry, because as long as the orders were signed at the last physical, they will still be valid until their next physical. Okay. I personally don't like seeing more than 30 days because after 30 days, 30 days overdue, we have to get those orders signed as soon as possible. So at that point, we need to have a game plan to get the orders signed by the healthcare provider. And you only have to worry about this in Department of Mental Health and DCF. So this doesn't really apply to our world, but they do have some other psychotropic medication orders have to be updated typically every 3 months. So that is just a little bit different for DMH and DCF. You don't really need to worry about that. Just as a note, a copy of the prescription for the healthcare provider ordered medication may be used as a healthcare provider order. This is rather new. I want to say about a year old in MAP, as here we are in March of 2026. I want to say it was about November of 2024 when MAP did start allowing us to use the healthcare provider script that goes to the pharmacy. And so this is really only good in some circumstances because a script does not discontinue any other medication. So if for example, somebody's taking an antibiotic and the doctor says, oh, that's not the right antibiotic here, I'm going to order another one, I want you to take that one instead. So they send that into the pharmacy. You can use that script as a healthcare provider order to post and verify and transcribe into the med sheet. However, we still need something signed by the healthcare provider to DC or discontinue the previous antibiotic. So in that instance, you're still going to need a signed order. However, there have been times where folks go urinary tract infection, which we didn't know about, and the office calls and says, hey, person has a urinary tract infection, just want to let you know we sent a script over to your pharmacy. So in that instance, the healthcare provider is not discontinuing anything. They're saying, start this new medication. And that's a perfect opportunity for us to ensure that we get that medication in a timely manner. That antibiotic gets started as soon as possible. Every med in MAP should always be started as soon as possible, but I would say an antibiotic is by far the most important thing to probably start as soon as possible, because any delay could then lead to the person becoming sicker very quickly. So you want to make sure that you can start that medication as soon as possible. So we can use a healthcare provider. We can use a prescription as a healthcare provider order. So I do want you to know that it's definitely not ideal, but in those, situations where we need to just start a med, we can certainly do so. After a medical appointment, you want to make sure that the pharmacy received the prescription. So this is when staff get back to the house. You call the pharmacy and say, hey, did you get a new prescription for X medication? You want to either pick up the medications or ensure that the pharmacy is going to deliver the medication, and try to find out the time the med will be delivered. Let them know that it's a new medication and we really need it as soon as possible. Do not get into a confrontation with the pharmacy, because although they do deliver, there's really no reason why we couldn't go pick it up either. So make sure you communicate that with the pharmacy. Bring back all of the healthcare provider forms, orders, and everything, and any information regarding the next appointment. Be sure you make that next appointment before leaving so that that can go on the calendar. If it does need to get rescheduled, then it's got to get rescheduled, but at least have that on the books so that we make sure that the person is on time getting their appointment. Share any appropriate information with the team, so making sure that the nurse is made aware, the manager, that you're uploading things into Therap, that you are sharing any relevant information that everybody needs to know about. We were talking a little bit about, for example, if the doctor doesn't want the person to have red sauce because they have GERD, then making sure that that information gets relayed to the whole team. You're going to transcribe all medication orders onto the medication administration sheet, post and verify all orders, secure the medication. Once you receive the medication from the pharmacy, you're going to lock it up immediately and document the visit. So you're going to write a progress note and a T-log and Therap about what happened at the appointment and communicate changes to all of the staff. So only certified staff, including relief staff, who have successfully completed the service provider's transcription of medication management system training may transcribe healthcare provider orders, post and verify orders, and complete monthly accuracy checks of healthcare provider orders. So this is super important for you to know. I know it's a mouthful, and the TMM system is something that we do. When somebody passes MAP, we will go over the transcription of medication management system training with all new employees or newly MAP certified employees, so that you are able to post and verify, do the accuracy checks of the healthcare provider orders each month. And this is something that's really important. So MAP has stopped testing people on transcription. So you only have your testing of your general knowledge and your skills, but you still need to go through the training of the transcription with the CSI nurse. So this is a healthcare provider order, and it's saying to fill in the blanks. So we have David Cook again, and the healthcare provider name, so where you're going to find that on the form. So if you can see here, Dr. Black, is the doctor, healthcare provider. The reason for the visit, do you see where that is? That's right here. So the reason is for David states that he is burning in his throat after eating. Who is the staff completing the form? That's Sam Dowd. The allergies. Where is that? Should probably move this up a little bit. Allergies are up here. No known allergies. The healthcare provider findings. So where is the findings? That's right. Gastroesophageal reflux disease, other known as GERD. New medication. So where's the new medication and what is it? New medication is going to be Prilosec 20 milligrams by mouth once a day before supper, and the healthcare provider instructions. Do you see where that is? Remain upright 30 minutes after eating. Good. So Tanisha went to the dentist today and she received a new order for an antibiotic. You return to Tanisha's home with a signed healthcare provider order. Review the healthcare provider order and complete the following exercise. So Tanisha Johnson, the date is February 2nd. Dr. Chan Lee is the healthcare provider. She has no known medication allergies. She's complaining of soreness in the back of her mouth. Her current meds are phenobarbital and clonazepam. And Sam Dowd is also attending this appointment. And let's see. Circle the new medication order. So that is going to be right here. What is the dose ordered? The dose is 500 milligrams. What is the frequency? Every 12 hours. So that means it's going to be like a 7 a.m. and a 7 p.m. or an 8 a.m. and an 8 p.m., but it cannot be, it's not twice a day, it's every 12 hours. So you got to keep that in mind. You got to stay within that exact time frame. So when it's scheduled, it's got to be exactly 12 hours apart. Now remember, you do have the hour window to administer. So if you have it scheduled for 8 a.m. and 8 p.m., you could give as early as 7 a.m. in the morning, as early as 7 p.m. in the evening, or as late as 9 p.m. Place a check mark next to Tanisha's current medications. So the current medications are right here. And does Tanisha have any medication allergies? No medication allergies. Good. People who manage appointments independently. When a person manages their own medical appointments, your responsibilities will vary depending on the person. Your responsibilities may include reminding the person of the upcoming appointment with their date and time, ensuring that the person has all necessary documents such as a healthcare provider order form, reviewing with the person what needs to be discussed at the appointment, arranging transportation, and reminding the person to obtain prescription refills. If the person does not bring back a new valid orders and prescriptions, it is your responsibility to obtain them. So keep that in mind. So it really helps to kind of prepare them and prepare the office for that appointment as well. If you're going to the emergency room, urgent care, or hospital, you want to make sure that you take the person's current med list, insurance card, and a healthcare encounter consult order form. Be prepared to tell the emergency room, urgent care, and/or hospital staff why you're bringing the person. The person might be scheduled to receive medications during the time that they're in the ER or urgent care. If so, you need to discuss with the healthcare provider that they're seeing to obtain a recommendation to address any medications that might be missed. So, for example, if a person is typically receiving their seizure medication 3 times a day, and, let's say 8, 2, and 8, and you are at urgent care right in smack in the middle of the day at 2 o'clock, you want to make sure that that hospital or urgent care, they're aware which medication was missed, and find out if that medication can be given when they get back home, depending on the timing. So get that in writing and document that as well, so that way medication isn't missed. And if it's something that can be skipped, have them document that too. Contact the MAP consultant immediately after the person returns to the site. And if you're calling the MAP consultant to get instructions, you want to make sure that the staff are documenting the discussion and any recommendations. When a person's been seen in the ER or urgent care, healthcare provider orders must be obtained for any medications changes. So no matter what, we always need healthcare provider orders for everything or for changes. If something's going to change from twice a day to once a day, or twice a day to 3 times a day, those all need to be documented. And the previous order would then be discontinued, and the new order would then be a new order. So the new instructions would be a new order. So in other words, if somebody had Prilosec once a day and the doctor increases it to twice a day, you would be discontinuing the previous Prilosec order, which was only once a day, and then rewriting and retranscribing a new order for the twice a day. You may have concerns about taking the person home or to work or day program after the visit. If so, tell the ER, urgent care, and or hospital staff. Make sure you contact your supervisor before leaving. So this is, something that if they need to stay home because they were seen, or they need to be on an antibiotic, they probably should stay home for the next, 24 to 48 hours following any kind of a trip to ER urgent care, unless they are absolutely fine and they just were going to get checked out. Sometimes a person is admitted to the hospital following an ER urgent care visit. Medication reconciliation, this is where we kind of ensure that their home medications are reconciled with the hospital's medication list, because a lot of times they can only see certain things and their med list could look very, very different from a file or from years ago. And I've seen this go wrong so many times because people just assume that the hospital knows. They're not getting the information from the pharmacy. They're getting it from like old visits or old hospital admissions. So you really don't know. They could be giving an old dose of a seizure medication or a wrong seizure medication or something that the person is now allergic to. So you really need to make sure when they're admitted that we are doing a medication reconciliation by the staff. And that's why it's so important that you have that med list with you of what they're taking at home, so that that can be reconciled with the hospital to ensure that they're getting the correct medications. So when they're discharged, we want to make sure that the discharge list from the hospital matches our list. And if not, we need to get clarification on anything that doesn't match. So that if something is changed, the discharge orders from the hospital will then take the place of the prior healthcare provider orders. So what we tend to do is make sure that our medication list matches exactly what the hospital wants the person to get when they get home, and that they're not making any unintentional changes. One example I see all the time is like acetaminophen. The doses that they give in the hospital are a lot different, especially for an acute condition. So their home order for acetaminophen might be 650 milligrams every 6 hours as needed for fever, headache, or pain. And then At the hospital, they may be giving 1,000 milligrams, but they might say, every 4 to 6 hours, 1,000 milligrams with no clear parameters. And so we need those parameters to stay in place and nice and clear and in MAP terminology. So typically when somebody is in the hospital, we do that med reconciliation with nursing, and we ensure that our orders match and have the doctor at the hospital sign our med orders, so that way it's familiar to staff and you're looking at the same forms, and we know that medication reconciliation happened when the person was discharged. So what a medication reconciliation ensures is that the healthcare providers were in place prior to the admission are continued as they should be. New medication ordered during a hospital stay is not accidentally omitted when the person returns home. And medications that were discontinued during the hospital stay is not administered when the person returns home. So sometimes meds have to change while a person's in the hospital. For example, somebody may have a bad reaction to a medication and the hospital wants that to stop. So therefore, that medication would need to be discontinued, and you don't want to miss that and then have the person discharged home and continue that same medication that caused the bad reaction.